最初にオーストラリアのシドニー地域保健局多文化プログラム戦略拠点長のバーバラ・ルイジ様からご発表いただきます。ルイジ様はニューサウスウェールズ州の公衆衛生部門で勤続30年。現在、シドニー地域保健局の多文化プログラム戦略拠点長としてご活躍中です。昨今では新型コロナウイルス感染症に関する外国人住民への情報発信や支援を行っています。本日はルイジ様からオーストラリアの多文化共生の現状に触れていただきつつ、外国人住民に対する医療通訳の活用など、オーストラリアの先進的な取り組みについてご紹介いただきます。それではルイジ様、よろしくお願いいたします。
Thank you very much. Good afternoon, everyone. It's an absolute pleasure and an honour to be here with you all today to talk to you about how we in Sydney Local Health District work with migrant communities and to share with you some of our experiences. Sydney Local Health District is one of the most culturally and linguistically diverse in New South Wales. In order to have good health among migrant community services need to be flexible and responsive. The two key mechanisms for working with diversity in the Sydney Local Health District are the Healthcare Interpreter Service and the Cultural Support Program. And throughout this presentation, I'll talk to you a little bit about both of those. But before I talk about those two models in detail, I would like to set the scene by providing you some background about the health system and the population of New South Wales. So in New South Wales at the moment, we have 8.2 million residents across 809,444 square kilometres, so quite a vast landscape. We have 17 local health districts and specialty health networks. Within those, there are 28 hospitals and 5 healthcare interpreter services. Now, Australia is a country that has been founded and built on migration, and it has accepted a number of permanent migrants every year until 2020, when our borders closed due to the pandemic. So just in 2019 alone, 257,203 people migrated permanently to Australia. Of these, 16,757 were humanitarian entrants, 90,000 settled in New South Wales, and of these, just under 6,500 were humanitarian entrants. Now, it is important to note here that I'm only talking about our permanent intake. These numbers would be significantly higher if we were also to include international students, temporary residents, and other long-term visa categories. Now, if we look at migration to Australia since the post-war period, we can see that migration is an incredibly dynamic phenomenon. Over the years, patterns of migration have shifted and changed, driven largely by geopolitical and economic forces, both in the source country and in the recipient country, that is, in Australia. And you can see here the vast range of countries that have comprised our migration program. Now, these countries from which we have drawn our migration, as I said, have changed over time. In the 1950s and the 1960s, the bulk of our intake came from countries such as Greece and Italy, when Australia needed young people to work in its factories, but preferred to draw from European countries because of our White Australia policy. These communities now make up our older, ageing demographic. In the 70s, we see the first influx of people born in Lebanon, fleeing the civil war that would go on to ravage that country. And similarly, in the 80s, we have the first mass arrivals of Japanese refugees escaping conflict. Australia's first large intake of people born in China occurred in the 1990s in response to the events of Tiananmen Square and the exodus that followed. Today, migration from China continues to remain at high levels. Since the mid-2000s, Australia's migration program has been driven by the intake of international students. In fact, our tertiary education and education sector is our largest export. These groups are typically younger. They're aged between 20 and 40 years, and therefore they tend to require health services that are focused on reproductive health, maternal and child health, and the early years of life. Now, if we look a little bit more closely at Sydney Local Health District, we can see that only 35% report being of Australian or English ancestry, and at least 44% are born overseas. And these are the major countries of birth for the Sydney Local Health District, as at our last census. There are 200 different languages spoken just in our district alone, and more than 50,000 people report limited English proficiency. And the impact of this cultural and linguistic diversity can be seen in the increased demand for our interpreter services over the years. So as you can see, it has been steadily increasing. But beyond language and the language needs of our migrant communities, there are a number of variables that also need to be considered when designing service models and health programs for migrant communities. And these include things such as the English language proficiency of the migrant group, their length of residency in Australia and therefore their understanding of the health system, the migration from low to middle income countries, the conditions of arrival and their migration category. Someone who is migrating as a permanent resident has a very different migration history than, say, someone who has arrived as a refugee. The age structure of the migrant group is key, and obviously the prevalence of endemic health issues in countries of birth. And this is particularly true of bloodborne viruses and infectious diseases. So what we have learned is that health services must adopt a flexible, responsive and adaptive model of practice to meet the needs of migrant communities. And to ensure that the Sydney Local Health District does that, and that there is equity across the range of migrant communities, it has adopted two key mechanisms, the Healthcare Interpreter Service and the Cultural Support Program. Now, there are 5 healthcare interpreter services, as I mentioned previously, across all of the New South Wales Territory. 3 are in metropolitan areas and 2 are in rural areas. Each of these provide a free 24-hour, 7-day-a-week service that consists of both on-site, face-to-face interpreting, as well as phone interpreting and video conferencing across more than 120 languages, including Auslan. And the service in Sydney Local Health District alone receives 8,500 requests per month. In New South Wales, it is government policy that interpreters must be used in a healthcare setting where the patient, their families or their carers do not speak English as a first language or are deaf. And this is briefly the policy that supports and mandates the use of interpreters in healthcare settings. Healthcare interpreting is available in a range of both hospital and community settings, as you can see here, and its purpose is to provide quality professional healthcare interpreting to healthcare providers and non-English speaking or deaf patients. It facilitates the communication between these parties to enable them to communicate as though they have a language in common. And it enables patients to actively participate in their care, to make informed decisions and to successfully navigate the mainstream services. The Healthcare Interpreter Service in Sydney comprises 43 full-time and part-time permanent staff. In addition, there are 262 sessional interpreters that are employed on a casual basis to supplement this full-time cohort. And in cases of extremely high demand or where a language is not available within that permanent pool, agency staff are also engaged. Now, healthcare interpreting is a highly technical and specialised field. Professional interpreters must achieve accreditation from the recognised Australian National Authority, which is known as NAATI. And to maintain their certification, interpreters are required to undertake ongoing professional development and continuous practice improvement. Interpreters must demonstrate competency in terms of their mother tongue, English proficiency, intercultural understanding, and ethical practice. Now, there are a range of interpreting modalities that are adopted in a healthcare setting. These include face-to-face, such as dialogue, consecutive, chuchotage, and sight translation. There are also telephone and video conferencing options, and these have been absolutely essential and critical to ensuring the availability of interpreting services throughout COVID in New South Wales. The interpreter service also provides professional translation, proofreading, and checking services. And it's important to note that in New South Wales, translation by a professional interpreter is mandatory for materials of a medico-legal nature, such as patient consent forms, and it's also recommended for highly technical and clinical documents. Now, in order to meet the increasing demand on health services driven by migration, Sydney Local Health District has developed another model that complements the healthcare interpreter service, and this model is called the Cultural Support Program. The Cultural Support Program consists of a pool of bilingual bicultural staff whose task it is to improve the delivery of services. The Cultural Support Program does not deliver any programs of its own. Its role is to integrate with a range of services, including maternal and child health, cancer services, diabetes, mental health, aged and chronic care, to add value by providing a cultural and linguistic dimension to the service provision. Cultural support workers are selected from a range of criteria, including their ability to speak, read and write in one or more languages other than English, their experience of working within health, welfare or community service fields, and their knowledge of their community and the community networks. Now, this is a long-standing but unique model in Sydney Local Health District. In fact, this model has been available since 1992, initially just for working in HIV, but since 2018, this model has been expanded to include a range of other health issues and healthcare settings. The Cultural Support Program currently comprises a mix of established and new and emerging communities and languages. The recruitment to these languages is guided by local demographics, hospital data, migration statistics, and broad global movements of populations. And we recruit to the Cultural Support Program roughly every 2 years due to attrition, as well as to maintain the responsiveness of the program to the fluctuations and changes in the migration patterns in New South Wales. The cultural support workers have a broad scope of practice, including community education, resource development, research and co-design, community engagement, media and communications, and psychosocial support. Cultural support program and cultural support workers undertake a stringent program of professional development, and this includes 2.5 days of induction training regarding their role. In addition, there is an annual program that must be undertaken that is both skills-based training, so for example, how to develop resources in language, as well as content-driven. So for example, the delivery of bowel screening information or hepatitis B community education. Cultural support workers are supervised by a trained coordinator, and they undertake regular support and supervision, which includes briefings, debriefings, and meetings. Now, the significance of the cultural support program became absolutely clear during the pandemic, where the focus shifted to preventing hospital admissions and keeping vulnerable populations safe. The flexibility and the responsiveness of this model were exactly what was required to enable the implementation of population-level strategies within the community. The cultural support program was part of the response from the very start of the pandemic in New South Wales, when our Mandarin speakers conducted welfare checks for travellers returning to Australia from mainland China in February and March 2020. As the pandemic progressed and the district's response broadened and evolved to include a range of public health measures and population-level strategies, the cultural support program and our cultural support workers provided in-language concierge and cultural liaison at COVID testing sites and pop-up vaccination clinics in areas of high migrant density. They conducted in-language contact tracing on behalf of our public health units in response to COVID-19 cases and close contacts in migrant communities. They also conducted audits of commercial and retail strips for in-language COVID-19 signage in suburbs of high migrant populations and ensured that the right in-language information was displayed and made available to these communities. In addition, they worked very closely with the public health environmental health officers by providing in-language support for the execution of COVID-19 safety compliance checks. Cultural support workers also were engaged in the development of a very vast range of multilingual resources across more than 20 languages to enhance the COVID-19 health literacy of a number of vulnerable communities where English was not the main language. Many of these resources were adopted for broader use across the state. They also developed a number of multi-platform communication campaigns targeting priority communities in response to local clusters, cases and hotspots, and of course to promote our pop-up vaccination clinics and ensure that our most vulnerable communities, regardless of their status, was able to access vaccinations. And finally, they conducted focus groups in language with communities to assist us in building a true understanding of the barriers and enablers to vaccination uptake. And here you see some of the languages that those consultations were held in. And the outcome of those consultations went on to inform our public health response and the development of communication messaging around vaccinations. So at the end of a very long 2 years of involvement in the COVID response, where have we landed? We've landed with the cultural support program being involved in the development of over 400 multilingual resources in over 20 languages, more than 800 radio community service announcements broadcast on 15 community language stations, 350 social media tiles developed in 15 priority languages and distributed on a number of community language platforms, and more than 100 staff covering 11 priority languages deployed to 7 testing sites and more than 20 vaccination sites, providing 15,000 hours of concierge and cultural liaison. So I'm sure that you will agree a significant input into the overall COVID response for the Sydney Local Health District. So I will leave you here now, and I'll leave you with a photo of some of our cultural support workers. Thank you very much for your time today.
ありがとうございました。